Hi everybody, my name is Kim Gilmore. I'm a family doctor in St. Mary's in Huron, Perth, where I've been practicing family medicine for the last 15 years. And I've been asked to talk to you today about vaccination against COVID, and in particular, the AstraZeneca vaccine. And what we're going to talk about right now is safety and the risk of using an AstraZeneca vaccine. As many of you have probably heard, the AZ vaccine has been associated with a very rare condition that causes blood clots. That condition is called vaccine-induced prothrombotic immune thrombocytopenia. Now that is quite a mouthful, so we call it VIPIT. VIPIT has been associated with the AstraZeneca vaccine, but it is exceptionally uncommon. And I think when we're talking about risk, it's really important to think about some numbers to know what kind of risk we're dealing with. The chance of developing VIPIT and blood clots after receiving an AZ vaccine is somewhere around 1 in 250,000. Now, again, to keep that in perspective, we have to look at other risks and kind of know what we're dealing with. So, for example, a woman who is taking a birth control pill has a risk of developing blood clots of 1 in about 1,600. A woman who is pregnant, just by virtue of being pregnant, has a risk of getting a blood clot of 1 in 300. The risk of having a blood clot if you get COVID is 1 in 5. So, COVID, chance of getting a blood clot, 1 in 5. Chance of getting a blood clot after receiving an AstraZeneca vaccine, 1 in 250,000. Now, 1 in 250,000 is obviously very small, but it is enough in the world of vaccine safety that we pay attention. And because of that, we are monitoring very closely what happens with these blood clots and so on. As a result of these blood clots, the National Advisory Committee on Immunizations, or NACI, has recommended for now that in Canada, we limit the use of these vaccines to people over the age of 55. There are two reasons for that. One reason is because it seems that people who are over the age of 55 are even less likely to develop this condition. And also we know that people over the age of 55, if they get COVID, are much more likely to have severe outcomes and even die from COVID. So for them, overall, definitely the benefit of vaccination outweighs any risk. Now, whether NACI changes its recommendation down the road has yet to be seen. They're monitoring the data, and they may change their recommendations. We will have to wait and see what they say. Health Canada has determined that actually the use of the AZ vaccine is safe in anybody over the age of 18. So again, risk of having VIPIT, 1 in 250,000. The risk of getting a blood clot after if you have COVID is 1 in 5. The bottom line is, whatever your opportunity is to have a vaccine, go ahead and get it. If that vaccine is the AstraZeneca vaccine and you are eligible for it, go ahead and get it, whichever one you can get first. I hope that helps to answer some of your questions.